Good evening, everyone. I want to thank our revolution. I want to thank New Jersey Universal Healthcare Coalition and all the other groups that have been active in pulling this evening off. And I am Seth Kaper-Dale, and I'm the Green Party candidate for governor of the state of New Jersey. So I have to give credit to NJ Universal Healthcare Coalition for this first part of the words I want to say today, because it was a graphic on your website that got me going. And I'm proud to say that because one of the things that I offer as gubernatorial candidate is I want to listen to the people who are working hard on the issues. I don't know all things about all things, and that's something that any gubernatorial candidate ought to admit. But the people of New Jersey do. There are people who are working on every issue that matters, and I've been really thankful for the guidance that I've received from the Universal Healthcare Coalition and from many others, so thank you. Where were you in 1991? I was living in the state of Vermont with a really cool mayor just up the road and then Congress. And I was playing high school baseball, and that's about all I was doing in 1991. I was not thinking about universal health care. But apparently here in New Jersey, people were thinking about universal health care, and 1.5 million people answered a public question on the ballot on Election Day. And the question was just there to get a read of the pulse on the state in regards to universal health care. How are people feeling about this? The people of every county in the state of New Jersey, at astronomical rates, wanted to see universal health care implemented. 78% of those who answered the question said yes, the nation should have a single-payer universal health care system. 26 years later, I would bet that if we put that question on the ballot statewide and nationwide, the people would respond with similar numbers, maybe not quite at such high losses happen this year, that a progressive shift might actually occur. How else can you explain that in the year of Bernie Sanders, the county bosses would preemptively choose to endorse a Goldman Sachs billionaire who has not mentioned single-payer health? And I don't know what regular Democrats in New Jersey actually wanted this year in terms of the primary. What I know is that I know what the party bosses wanted, and I know, too, what money can buy when it comes to name saturation. So is New Jersey ready to commit to single-payer? We better be. I'm running as the Green Party candidate because I believe that the only way for a true revolution is to undo the power of the money people who run the duopoly. Without a third-party alternative, they'll just keep having their day with all of us. This single-payer conversation is way overdue, and the other states that we like to compare ourselves to, states like New York and California, they've been having these conversations for real, and their electorate has woken up in huge numbers. People will start losing elections in those states if they don't get in line with a single payer. And that should be happening here too. And so I ask this body, are we ready to make sure that people who don't line up with single payer start losing elections? Until we're ready collectively to care so much about single payer that we'll make it the central issue of whether someone stays in office, I don't believe that we'll see the change that we want to see. There is one party in the state that's bigger than the Democrats or Republicans, and it's the untapped party as far as I'm concerned. There are more independents than there are Democrats or Republicans, and I would venture to bet that if you were to combine the independents and the single-payer fans within the Democrats and Republicans, we'd blow the duopoly of corporate wealth right out of the water. As Bernie showed for a time last summer, sometimes people care more about a revolution of values and more about an economic revolution than they care about party affiliation. Flyover states started to look like they might go blue, not because people wanted to be Democrats in some of those states, but rather because they believed in single payer and a few other major issues that have to do with the care of all of us. So I'm on the ballot in November, and I'm committed to making sure that Phil and Kim answer the single payer health care question constantly. Every opportunity I get to ask them directly, I will be asking them. Every opportunity I get to talk to assembly members and senators, I will ask them. The state of New Jersey is an extremely wealthy state, but you wouldn't know. The state is broken, and lots of families are on the edge of financial trouble or over the edge, largely because we throw hundreds of billions of dollars away each year to overpriced, underperforming health insurance companies that are looking out for shareholder interests and who take home disgustingly high compensation. And this has to stop. Instead of spending hundreds of billions on health insurance, let's spend significantly less on our own single-payer plan and provide platinum-level care for every person who lives in and works in New Jersey, cradle to grave. I like what you said, conception to grave. And let's see an economic stimulus like the state hasn't seen in decades. So first, let's talk about the health of our bodies. Every person in our healthcare plan will be able to go to the doctor of their choice, to the hospital of their choice, get the drugs they need, the mental health services they need, the dental care, the women's health care they need, the long-term care. And every person in this single payer plan would have no co-pays, no deductibles, and other fees. Healthcare providers, as has been said already so much tonight, could focus on providing care instead of fighting for reimbursements and investing tremendous time and energy in this for-profit game, just to fight off the insurance company greed. Eliminating health insurance carnivores restores the integrity of the healthcare profession. Prevention programs and health programs of all kinds of opportunities to encourage healthy living could become part of the way we think as a state. I can imagine community health and wellness centers in parts of Newark that encourage health and wellness from cradle to grave. Maybe after-school programs and child care centers would see some increased funding through our single-payer plan. We might find some beautiful ways to expand how it is that we understand health. Finally, I find it sinful that Obamacare has made it acceptable for us to perpetuate Medicaid for poor people and something else for other people. It has solidified our multi-tier system. You get better care if you're richer. You can go some places, but not all places if you're poor. And you can get some reimbursement from care providers, but not much if you're serving someone poor, especially that has to do with their mental health care. Without a doubt, with single payer, our collective health would improve and the morale of our health providers would increase. I imagine a whole new job sector springing up as more people who suffered sick for years start getting the care and the treatment that they need. So it's good for our body, of course. But the other thing that's good for our body is not having the stress, the economic stress that's part of our lives. And I think that this is the piece that it all started making sense for me the more and more I explored the connections between healthcare, universal healthcare, and what it means economically. $15 per hour becomes an easy sell to business. Right now, businesses are often caught between a rock and a hard place, saying if I increase my hourly wage and my health insurance goes up 15% next year, I'm not going to be able to keep this balance. But if they knew exactly what they're contributing through their employer payroll portion, contribution to New Jersey single payer Medicare for all, then they could move up to 15 now. We'd see much better wages. In New York, businesses paying for health insurance plans say that it eats up about 13% of their payroll right now. Workers cut off at 28 hours so as not to, because their employers don't want to have to pay for another health insurance plan, would now be able to work 40 hours without any struggle whatsoever because there's no connection between how many hours you work and your health insurance plan. Small businesses that don't offer insurances right now, and we might say, oh, this could get hard for small businesses, this increase in the payroll tax would be something like $20 a week per employee. And the benefit you get from that is your employees now are going to stick because they don't have to leave soon to go find a job that includes a health insurance plan. Municipal and school budgets, this is where it gets really big. They could be dramatically reduced as healthcare costs would be so much lower than the current private health insurance packages that are being paid for. Like 15 to 20% drop in the municipal budgets in every town. So people say, how are we going to bring down taxes? We can do it by providing better health care for the people who live throughout our state. College tuition would go down as the cost of providing health care for employees would go down and the state could shift costs that are currently obligated for health insurance into funds to assist lower tuition. And finally, the state pension fund could be paid in full. If the health insurance cost for state employees and teachers was slashed dramatically, there would be no excuse for underfunding the pension mandate. When I've looked at the documents frequently in a given year, about half of what goes into the benefits package was supposed to go to the pension, and the other half is supposed to go toward paying for the health insurance plans. We always have to pay the health insurance plans. They don't say, oh, you can kick that one down the road. That always gets paid. The pension plan we push off for another day. But if we take care of health care once and for all, then we can take care of the pension. The other thing that goes away is the unfunded post-retirement liability that communities face when, like, a teacher retires before they're eligible for Medicare. Hospitals and drug companies would have to be much more responsible with their billing. No playing games with a variety of companies. And finally, freedom. Imagine a country where people could follow their dreams. I was at a middle school graduation today where I heard speech after speech about, dream what you want to do with your life and all this kind of stuff. What if people could actually dream about what they wanted to do without having to make sure I can dream as long as my dream keeps me in some job that'll get me a health insurance plan, which is what stops Americans right and left all the time. The beauty about all this is it can be done in New Jersey. No act of Congress is needed. There is space in current Medicare law to allow for experimentation. The beauty is we just need good legislation. And I think we have great models in California and in New York, and now from Assemblyman Wisniewski. We're going to need to establish a Medicare district exclusively for New Jersey, but I think that one of the most exciting things about this is we can hold the word exclusively very lightly, because there's nothing saying this has to be New Jersey only. And wouldn't it be beautiful if we were open to the fact that this could expand regionally and very quickly could move in a national direction? Canada didn't all happen at once. Canada started in one province, and quickly then the nation woke up. We could do that too. And the other thing that's beautiful is that the system for this to all happen is already in place. Doctors and hospitals and labs and physician networks are already billing Medicare. The coding, the paperwork, the payment process, it's already established. We would be able to just remove the middleman, the private health insurance. It would add that organization or that swath of this system that adds nothing but cost and waste to our healthcare system. This program, as I see it, would live under the Health Commission and the Commissioner of Health and a board of directors that's made up of healthcare professionals and consumers and others. All monies from the federal government would end in one pot, as well as all the money coming from the 6% payroll tax on employers and 2% payroll tax on employees. That's what would go into the New Jersey Health Trust Fund that I believe would be able to fully fund this project. Friends, I do believe we can do this. I don't think that we are at all dreamers. I actually think it's a dream to think that we can't do this. And I often feel that way just in life, that a lot of the times when we're told, well, gosh, we got to go to war, it's the only way. No, it's actually the most ridiculous dream in the world to think that we're going to war our way to peace. And it's the most ridiculous way in the world to think that we're going to be able to get to something that looks like true universal health care if we keep going down this road that blesses health insurance companies and big money. Thanks so much.
Thank you so much. So we're going to have Frank come up next and speak for a few minutes, and then we'll do some questions.
Okay. First of all, I want to thank Marianne Benefit for inviting me tonight, and I'm humbled by the other panelists that are here somewhat, and I will be kind of taking maybe a little bit of a different tack than what you've heard so far, but actually reinforcing some others. The first that I wanted to note is when Bernie Sanders talks about single payer Medicare for all as a right, you may not be aware, and maybe some of you hopefully are, that a fellow by the name of Thomas Paine, common sense, the firebrand, created winners and losers. So he starts off this wonderful 12 to 15 page document, pamphlet, if you will, depending on the font size, with the following: agrarian justice, to preserve the benefits of what is called civilized life, and to remedy at the same time the evil which it has produced, ought to be considered as one of the first objects of reform legislation. Now, agrarian justice, I just said, was not about farming. How many of you might guess what it was about? Little known. He was the creator, and is actually acknowledged by the Social Service Administration and FDR, with creating the first universal system of social insurance. Instead of, at age 62, you didn't have early retirement and full retirement benefits. You started your lifetime payments at the age of 50 because people didn't live as long. But he also had a unique little thing in there. He said people should be given a break, a little kick that could start their lives. So at the age of 20, he gave them a one-time benefit. He has, at the end of this document, which I have a copy of with me, actually all the math that makes this work. I'm going to give you his math. He indicated that it is not a charity, but a right, not bounty, but justice that I am pleading for. So when you think of anything that is called an entitlement today, remember, this is all about Social Security or social insurance, but it also can be relevant to anything that any politician, any elected official, anybody that's against single payer calls an entitlement, whether it be Medicaid or welfare or anything that is means tested. He also dealt with the means testing of rights. And he says, if I can find it is proposed that the payment starting at 50, as already stated, be made to every person, rich or poor. He understood, and he goes on to say, that if only a certain segment of the population, by income or class, is provided this right, single payer, Social Security, what have you, that the not so poor, the not so moderate, the not so middle income will not want to pay for it. In other words, the wealthy and the middle income. And wasn't he correct? As soon as you start having distinctions in terms of income and class, we have a problem, which is the reason why Medicaid becomes something that they can attack so readily. Single payer, and I've been studying public policy for years. Very quickly, I worked for Mayor Bean, Mayor Koch at fairly significant levels. For Mario Cuomo, Governor Mario Cuomo as a deputy commissioner. There are very few areas of public policy that I have not worked in, and income inequality has always been my number one issue. And I'm kind of delaying it for a while because of single payer. And I'm very glad that Seth actually recognized the relationship between single payer and income inequality, because it is fundamental. It's cross-cutting. There are so many things. It is so right, and most of you may know already the writers. You've got HR 676, you've got the state actions, the legislative actions, you've got organizations, you've got national speakers that are renowned. The list is amazing in terms of the number of things that single payer has got going for it. It also is a wedge to open up our democracy to the extent that we have one. And I don't know if you are familiar with a wonderful research paper that was, I think, about three years ago, by two university professors, one from Princeton University, the other one from Northwestern, that did a study of over 1,900 public policy issues and came to the conclusion that the normal citizen, the average citizen, has zero statistical impact on any policy. And I'll quote, in the U.S., our findings indicate that the majority does not rule. When a majority of citizens disagrees with economic elites and or organized interests, they generally lose. Moreover, because of the strong status quo bias built into the U.S. political system, even when a fairly large majority of Americans feel for change, they genuinely do not get it. So there's a lot of things, if you have a copy before you of my little outline from my own remarks, and I've been doing that since I was 22. After I have an outline. You can see all the reasons why I think, from the ones that I didn't even put, even national security, gun control. Okay? Well, we don't have mental health facilities sufficiently. Mental health is covered under HR 676 as a service. Now to a national, what I conceive of, just throwing out ideas, as a national evidence. The first element is something that's close to my heart. For years, I've always had the value that I would love people to speak on their own behalf, to know as much or more than I know. So I have been trained as a community organizer many years back. The guy is still alive. Organized Training Center, San Francisco, Mike Miller. And I always had this value. So I think that it's necessary in terms of democracy, given what I just said, for as many people as possible, not just those that are engaged in social media and through other organizational means, but the average person. I talk to walls. I have occasion to visit 6 states every 6 weeks. And as a matter of fact, because of that, I met Dr. Flowers in Asheville, coincidentally, in the presentation that she gave. And I asked people, do they know about the healthcare issues, single-payer Medicare for all, etc. Invariably, they do not. So one of the things that I'm suggesting, my fantasy is that this would almost be a standalone, nonpartisan. And the reason why I say nonpartisan is I have a friend of mine who is an avid Trump supporter. And I wanted to engage him because he has a catastrophic health insurance situation coming up at the end of August for he and his family, 2 kids, wife. And he started off with the whole taxation and so forth and so on. This was not a short conversation. But he came around, cut it short, to being an avid supporter of Medicare for all, single payer. Now, I must tell you that he's still a Trump supporter. He separates out. But what I did was, forget every single time he wanted to go into back and forth about Trump and Hillary, and there's nothing that Trump can do without being criticized. I said, Tom, let's come back to the situation that we've got. And we were able to go back to it. And after about 35 minutes in the hallway, sitting down on the floor, we agreed. He's now an avid supporter, probably would wear that t-shirt that's floating around HR 676. What does it mean? Resources and organization. I'm an organization guy, so you probably do. You can read for yourselves. The hard-hitting, relentless political campaign. My fantasy, and I have found out by making a lot of calls, that the House Minority Leader and leadership in general in the Democratic Party is holding the 112 current co-sponsors of HR 676 to a code of silence. They're not basically allowed to talk about HR 76. So it is crazy. So I'm talking about, number one, Democratic leadership. There should be at least 5 tenths in front of Nancy Pelosi's office perpetually until she divorces the sentences. Anyway, DNC, what are they doing? Caucuses. Congressional Progressive Caucus, Black Caucus, Hispanic Caucus. Given the constituencies and the socioeconomic data that the last 2 have, Hispanic and Black Caucus, all of them should be co-sponsoring HR 76. If those 3 caucuses were co-sponsoring, there'd be 140 out of the 193 Democrats in the House. The last element there, essential, 3 to 5. I think elected officials have to pay a price. They have to have the fear of God or something. They've got to know that if they're not supporting single payer, they're going to pay a price. Somebody else is going to have to pay the seat. Media campaign. Like many people, the only other thing that I watched with my wife 3 hours in a row is Law and Order. You come to the end, and then you have the next program or the next episode. Well, for us, it has been Chris Hayes, Richard Manna, and The Last Word. And it dawned on me that this is almost an archive. We were at one point on Tuesday night watching something on C-SPAN, a wonderful show, terrific information, and suddenly I'm getting an urge. It's not fast-paced enough. I didn't say breaking news. And I wanted to change the channel to Chris Hayes or Rachel Maddow. It has become an archive, a sliver of information, new information that we get on these programs is killing us. What I'm saying there, I think direct action in terms of demonstrations at the studios of MSNBC and CNN is worthwhile here. There are some things, little demonstrations, not little, or marches or what have you, along with other things may make an impact. The last one, coalitions. And this is organization of organizations, which is the second model in the organization of people, community organizing people, but also organization of organization. Very quickly, what I'm suggesting here, there's a national, wonderful fabric with regard to single payer. For single payer, eventually, developing a leadership on a national level to the extent that it already has been wonderful. Choosing another topic, I think I threw in climate change. You've got Bill McKibben, you've got 350.org, etc. The idea here, and I actually did this because I worked in New Jersey, and two of my happiest years in the 1970s was running the executive director of a Puerto Rican Hispanic agency by the name of Aspira, New Jersey. Started in 1968, it's still there. I was on 784 Broad Street when it's still there. And there was an issue in the mid-1970s called Robinson versus Cahill. It was a decree that said the present financing of school systems in New Jersey was unconstitutional because it relied solely on real estate. And I got involved. And through a coalition of nonprofit community-based organizations in Newark, Oye, Focus, some were daycare related, some were housing related, etc. I brought together a group of people who did not meet in my office, met in somebody else's office, and said, well, I'll chair this because it's education related, and I happen to be the executive director of this nonprofit. But when it comes to housing, Don Rosario will chair it. When it comes to daycare, somebody else will chair it, and so forth and so on. We managed to work with the Greater Newark Urban Coalition, Gus Henenberg, and another fellow that went on to New York Department of Aging, Eugene Callender. They gave us money. A number of New Jersey foundations gave us money. We developed forums like this around the state. We had a big one in Trenton at the Holiday Inn, and we made a lot of noise in terms of that thorough and efficient educational issue that was very ripe in the 1970s. The one thing that I will tell you, having been involved in efforts like this, is, as I located in the last two little words there, compromise, discipline, patience. The thing that minimizes the effectiveness of coalitions is egos. If egos can be set aside, either through candy or wine or something else that helps, it can be a wonderful thing. And I think single payer is terrific, these panelists are terrific, and all of you are terrific, and thank you for having me.
So I'm just going to be mindful of what time it is. I think that we can stay in the room a little bit longer, but I'm going to change my plan about putting questions in the middle here so that our last speaker of the evening can have a few minutes. What I do want to do before we do that is make sure everybody knows we have a Facebook page just for this topic called NJ Medicare for All. We have not had time to answer questions, so what I would like to do is actually post these questions on that page and encourage each of our panelists to chime in a thread. We can have a nice Facebook discussion continuing the conversation. I'd also ask you to share that page with your friends, and also please follow Our Revolution Bergen County, which has a great discussion group with 230, 250 members, and it's a great way to share these resources. So, if you guys don't mind waiting a few more minutes, I'm going to introduce our final speaker of the night, Mr. Larry Hamm. Larry is...
don't have to tell us, they know.
Yeah, Facebook needs to know this man is a hero, a fighter for justice, economic justice, racial justice, healthcare justice, environmental justice, educational justice. He's been a great leader for New Jersey, for Newark locally, for the state, and we're so glad you're here with us.
Thank you. I'm very glad to be here, and I'll try not to hold you too long. You've had a number of great speakers, and they haven't left much on the plate. There's not much left to say about single payer. So let me share some of my inner thoughts with you. First of all, whether or not we have single payer, and I do believe we can have single payer. In fact, I would say it is an imperative of our time that we realize single payer universal health care in the United States. It is an imperative of our time. But whether or not this is achieved depends upon our political power. What we achieve will be commensurate with the amount of political power that we accrue. Let me just talk about the last primary election. As you all know, well, let me go back in a year. As you all know, many of you know, I was a delegate for Bernie Sanders. And I'm glad to say that I was a delegate of Bernie Sanders. And I think that had we elected Bernie Sanders, we'd be in a different situation right now, and we wouldn't have to wonder whether or not we had single payer health care. So I was a Sanders delegate, and John Wisniewski was the chair of the Sanders campaign in New Jersey. After the election was over and ended so ignominiously, John then announced that he was going to run for governor. I thought this was a good thing because I felt that the Sanders voters in this state could be a new and powerful political force, and that John's campaign would be a way for us to continue the fight for the platform that Sanders ran on, which included single-payer health care. So John Wisniewski was a candidate. What was unusual about this Democratic Party primary election was that we had 6 candidates on the ballot. I'm 63 years old. I've been following elections since I was in high school. I cannot remember a primary election where there were 6 Democratic candidates running for governor at the same time. I felt that this was indicative of fissures within the Democratic Party. See, there are different spirits in the Democratic Party. There's the corporate spirit that would in fact lead the so-called leaders of the Democratic Party who profess to be champions of the working class to in fact pick a member of the millionaire class to be our representative in Trenton. So that's one spirit. Then there's the other spirit, which I feel was best represented by Bernie Sanders, and that is the spirit of the people. And I felt that I needed to support John because he was a good candidate, because he had a good record. But I'm going to tell you the truth. My reasons for supporting John was because I felt his campaign was a vehicle to build and pull back together the Sanders voters so that they can become a powerful force in this state for progressive politics. See, this is what happened. In the primary, Bernie Sanders didn't win the New Jersey primary, but he did very well. He got about 1/3 of the Democratic votes, about 36%. Bernie Sanders got 328,000 votes in this state. I thought that was significant, that 328,000 328,000 Democrats in this state were not afraid to vote for an avowed democratic socialist. I thought that that was a step forward in politics here in the state of New Jersey. That they were not scared of voting for someone who said he was a socialist, not scared of someone who said he wanted universal health care, not scared of someone who said he wanted a living wage for all working people, not scared of someone who called out the billionaire class for being the greedy, destructive class that it is in our society. 328,000 votes. What's significant about that? What's significant about that is that the person who won the Democratic primary won it with just over 200,000 votes. If the Sanders voters, we can stand here all night and talk about the misleaders, but if the Sanders voters had united and voted as a block, even if it wasn't 100% of them, if it had been 75% of them, or even 60% of them had voted in the primary, John Wisniewski, the only legislator to introduce a bill of single-payer health care, would in fact be the gubernatorial candidate in the general election. We have to realize the power that we have. And we have to struggle against ourselves and against the defeatist tendencies that we have individually and collectively. Single-payer health care can become a reality, but it won't become a reality unless we unite the progressive voters in this state and seize political power. All right. You know who won the election? Money won the election. Money won the election. Yep. The person who won the Democratic primary spent 4 times the money of all the other candidates combined. That's who won the election. We got to get money out of our elections in the United States. So, the winner had 200,000 votes. The next 5 candidates, the next 2, each had roughly 100,000 votes. Jim Johnson had 100,000, and John Wisniewski had 100,000. And the 3 others had the rest. But here's the thing. Just the votes of the second 2 in line were more votes than the winner. There is a split in the Democrats in this state. There is a split. I'm almost of the opinion, and I'm an admitted conspiracy theorist. Yes, I think people are conspiring to keep power out of the hands of working and poor people in this country. Yes, I am a conspiracy. I'm almost of the opinion that we had so many candidates that maybe there were forces moving to encourage people to run so that they would in fact split the vote and a progressive Democrat could not be elected. And this is the challenge that faces us. The challenge that faces us is we have to find enough unity. There's not going to be any all-encompassing magic unity. Everybody wakes up in the morning on the same page. But there must be a critical mass large enough to, in fact, beat back the corporatists within the party. And it's there. All you got to do is add up the numbers. You don't have to be a PhD in mathematics. Just add up the numbers. But we have to unify. The progressives in this state have to unify. And that is the task on the road to power and on the road to single-payer health care in this country.
Yes.
And we need single-payer. The other thing we have to do, we have to unite. See, all of us in here, we're for single-payer. We know the arguments. We almost preach it to the choir. There's not too many people in here need to be convinced. The people that need to be convinced are out there in the community. And what we have to do is understand. I remember the first time I heard single payer. I didn't know what they were talking about. Single payer? I mean, there's one bill, you pay the bill. That's what I call single payer. Single payer, man. A lot of people don't understand. So it is imperative for us to unite the struggle for single payer health care with the other health care related struggles that are going on in our community. For instance, we need to unite the struggle for single payer health care with the struggle against hospital closures in this state. In the last 5 years, this state has closed more than 25 hospitals, creating an overburden on the hospitals that are left. And God forbid we should have an epidemic or a pandemic occur in which these institutions do not have enough resources on staff to adequately respond. We must unite the struggle for single-payer health care against the budget cuts in this Trump budget against health-related items in the budget. We must unite that struggle with the struggle against budget cuts. We must unite the struggle for single-payer health care with the struggle for affordable pharmaceuticals so that people can pay. I had a friend. His name was Roosevelt Hobbs. He was a member of the Teamsters Union, and he was a truck driver. And Brother Hobbs died some years ago. And the people close to Brother Hobbs told me, they said, Larry, you know why Brother Hobbs died? I said, no, why did he die? They said he died because he could not afford those radioactive pellets that he needed to treat the cancer. That he was, in fact, having the doses, cutting the doses in half in an attempt to try to prolong the use of the medicine, and he wasn't taking enough medicine to fight the cancer that he has. It is criminal what they're charging for drugs in this country. It's criminal that people should have to go to Detroit or go to Albany and then cross the river into Canada to buy their drugs, that they need their prescription drugs because they cost only 1/10 of what they cost here in this state. It's criminal for these pharmaceutical corporations to be profiting off the misery and the sickness and death of the people in this country. And they need to be locked up. We need to do some citizens arrest and lock some of these corporate CEOs up. We have to unite the struggle for single-payer health care with the everyday struggles around health-related questions that people are going through in this community. And then lastly, we have to believe that in fact we can achieve this, and we have to organize in such a way that we're going beyond our own circles. In some ways, some of us who are radicals, we just like the church people. We only want to be with the people. We say United Front, and United Front would mean our revolution, POP. They all believe the same thing. That's not a united front. A united front is when you unite with people who in fact may have some fundamental ideological disagreements with you, but you unite around the common goal of single-payer health care. That's a real united front. We got to talk to people, just like Brother said, who may not see things the way we see them, but they do have enough understanding to know that the way we're running our healthcare system now is wrong. This is the richest country in the world, but we live in a retrograde capitalist country. This ain't even a good capitalist country. There are other capitalist countries that take better care of their working people than this capitalist country. Canada next door has universal health care. Po-ass Mexico down south, they got universal health care. England, France, Germany. You don't see people in France and Germany going bankrupt to pay for their cancer treatments. That's only here in this retrograde, backward, rapacious, profit-driven system that we live under. And we'll be better off when we get rid of this system and have, as Dr. King said, a radical transformation of our socioeconomic system so that healthcare We cannot let it happen. If we let a Republican get elected in this state as governor, that strengthens the hand of Donald Trump.
That's right.
We cannot have a Republican victory in this state. You get a Republican victory, we'll be 20 miles back from seeing universal health care. And we must break the stranglehold of neo-fascism on our government. It's not just a Trump problem. Trump is the titular manifestation of what exists. It's a whole illegal regime that exists. We will not get universal health care if we have Republican-dominated House and Senate and White House and Supreme Court. That stranglehold must be broken. And I know some people don't like to hear that, but you wait and see. But we can change this. We can change this if we unite. And I just want to say good luck to Brother Seth Kaper-Dale. I know what he's going through. I ran as a third-party candidate at one time. How many people remember Arthur Kenoy, the civil rights attorney? Arthur Kenoy and I were on a ticket in 1989. Our slogan was people's needs first. We were third-party candidates running against the Democrats and the Republicans in the general election. So I know what the uphill battle is that you're going through. But I'm telling you, we got to break this stranglehold. We got to unite. We got to use, as people are talking about, the resistance and all of that to Trump. We have to hook up to that. See, when some of them talk about resistance, yeah, they want to resist. They want to overthrow Trump, but they just want to return things back to 2016. I don't want to turn things back to 2016. I want to turn things all the way over and build a new 2020. That's what I want. That's what I want. And we got to do it. Look, if we can't build a movement now, we'll never get it built. Conditions have never been as right as they are now for a progressive people's movement in this country. But we have to build it. And we have to redouble our, we old veterans who are tired, we got to get untired and get back in the struggle. I know you're tired, but I'm tired. I'm tired too. But I'm not going to stop fighting. And if I lose my ability to walk, and if I can't see, and if I'm in the nursing home, just stick me in a wheelchair and roll me to the nearest demonstration. All right. That's what I want. I want to demonstrate.
Okay, wow. I don't know what to say. Thank you. You know what? I want to challenge everybody. Can we try to make this united front? Can we try to find that person who might be on the other side and have a conversation with them about this topic and not just talk amongst ourselves, but reach out, reach beyond.
You will feel so good.
It feels really good. It feels really good. So we're way past the time when this was supposed to end. If you have questions, please write them down on an index card and give them. We'll put them on Facebook. I think I'm going to cut it off and not have questioning. Can you guys stick around in case people come up and want to say hello for a minute? All right, so we'll just do that kind of informally. Again, thank you to Ariana for everything. Thank you for this and David and Danny and everybody who came up.